Welcome to this deep dive. Today we're taking a closer look at how healthcare systems across the globe are working to improve the quality of care they provide.
Mm.
We've pulled together information from accreditation bodies, quality improvement organizations, healthcare consultancies, and some real-world case studies
Yeah, quite a mix.
to give you a clear picture of what's happening sort of on the ground. Our
Yeah.
goal, well, it's to cut through the noise and deliver the key insights.
Those aha moments.
Exactly. Those moments that show you how healthcare is evolving worldwide.
And we've explored resources from some really key players. Think Joint Commission International, JCI, and India's NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers.
Okay.
And also the International Society for Quality in Healthcare, ISQA, plus perspectives from consultancies like Supremedic, and, like you said, a whole range of practical examples. QI in action.
So our mission here is basically to distill the most important lessons, maybe some surprising discoveries from all these different sources. We want to give you a solid understanding of global healthcare quality improvement, but, without totally overwhelming you with detail.
Makes sense.
Okay, let's get into it then. Where do we even start? How do we begin to understand how all these organizations worldwide are trying to get better?
Well, I think it makes sense to start with the foundations, the frameworks and standards that kind of guide these improvement efforts. Accreditation is a really big part of that.
Right. Okay, so Joint Commission International, JCI, that name keeps coming up. What exactly is their role? What do they do?
JCI is, well, they're a really significant international organization. Their whole focus is on healthcare quality and patient safety. They operate in, I think, over 70 countries now.
70. Wow.
Yeah, and have accredited over 1,000 different healthcare programs. Their core mission, they state it as, to enable and affirm the highest standards of healthcare quality and patient safety for all. So think of them as a global standard setter, really.
And it's clearly more than just, getting a piece of paper. We saw some really interesting comments from hospitals that went through it. Hong Kong Adventist hospitals, for instance.
Wow, yeah.
They described it as a fantastic way to build their team, improve how everyone works together. That seems like a pretty powerful, maybe unexpected benefit.
It really is. And Burjeel Farha Hospital mentioned something similar, that accreditation gave them a competitive advantage and, importantly, really boosted the community's trust in them. So it shows that focusing on quality, it has these real tangible benefits, both inside the hospital walls and, outside too.
That's a great point. It hits internal operations and external perception. Now, in India, you mentioned NABH, the National Accreditation Board for Hospitals and Healthcare Providers. How does that fit into the picture?
Right. So NABH is essentially India's own dedicated accreditation body for healthcare. It's part of their Quality Council of India, and it's specifically focused on setting quality benchmarks that are, let's say, tailored to the Indian healthcare context.
Okay, so more localized.
Exactly. And it's important to have these regional bodies, They understand the specific challenges, the opportunities within their own countries, but they're still aiming for those international good practices.
Makes sense. And beyond just the accreditation itself, JCI seems to offer a lot more. We saw mentions of their specific standards, international patient safety goals, educational stuff, even a conference coming up, Unified 2025.
Yes, exactly. They provide a pretty comprehensive toolkit for quality improvement. Those international patient safety goals, for example, they highlight very specific areas where patient safety often gets compromised, things like medication errors or hospital infections, and they offer concrete guidance on how to tackle them.
It's useful stuff. And then there's ISQA, the International Society for Quality in Healthcare. They sound like, the global hub for people in this field.
Pretty much, yeah. ISQA is a nonprofit. It's member-based, and they've been working for, over 30 years now, promoting healthcare quality worldwide. Their main focus is sharing knowledge, providing education, and offering external evaluation services. And they also host these major international conferences. There are ones coming up in São Paulo in 2025 and then Dublin in 2026. It really shows you the level of global interest and collaboration in this space.
So we've got these big organizations setting standards, driving the conversation. But how does all this actually, translate into better care for patients on the ground?
Yeah.
Let's maybe look at some real-world examples. What one source called the QI playbook.
Yes, this is where it gets really practical, where we see the principles applied and the actual impact on patients.
Okay, where should we start? How about the UK? They tackled a big problem with surgical site infections, SSIs. These were a major cause of complications after surgery, weren't they?
They absolutely were a huge issue. The solution involved rolling out a national surgical safety checklist, basically, a standardized list of checks for different stages of an operation and combining it with care bundles.
Care bundles. What are those exactly?
Oh, okay. A care bundle is essentially a set of, say, 3 to 5 evidence-based practices that, when you perform them together consistently, they've been shown to significantly improve patient outcomes for a specific condition or procedure.
Got it.
So in this case, the bundles focused on things like screening patients for infection before surgery, giving antibiotics at precisely the right time, and crucially, using that WHO surgical safety checklist.
That checklist, it just seems fundamental for safety in the OR, doesn't it?
Oh, absolutely. It gives the surgical team a structured way to communicate to make sure critical steps aren't missed. You know, the simple stuff sometimes.
Right.
So combine that with proper staff training, a real push to get everyone engaged, and the UK saw a really remarkable 30% reduction in SSIs.
30%? That's
Yeah.
massive.
It is. And it didn't just mean patients recovered faster, it also led to pretty significant cost savings for the NHS. The big takeaway here, I think, is the sheer power of standardization and getting the whole team truly engaged.
Okay, powerful example. Now let's shift focus. Our next example takes us to sub-Saharan Africa, specifically Uganda and Kenya, tackling the urgent issue of maternal mortality. Such a critical area.
Incredibly critical, yes. The rates of women dying from complications related to pregnancy and childbirth were, frankly, tragically high, often because of a lack of skilled healthcare providers, difficulty accessing emergency care, limited awareness. Just a tough situation.
So what do they do?
Well, the Safe Motherhood Initiative tackled this head-on with several key strategies. First, training more skilled birth attendants people with the right skills to manage delivery safely. Second, educating communities about why antenatal care is so important and how to recognize warning signs during pregnancy and labor.
Community education, okay.
And third, setting up emergency transport networks. Basically, ways to get women who needed urgent help to the right medical facilities quickly.
So a multi-pronged approach. What was the impact?
A really significant impact, a 40% reduction in maternal mortality.
Wow, 40%.
Yeah, it just powerfully shows how focusing on education, ensuring access to skilled care, and having those emergency systems in place can literally save lives, even in really challenging resource settings.
Incredible. Okay, different context again. Let's go to Japan. Keio University Hospital in Tokyo adopted lean healthcare principles. Now, we hear about lean in manufacturing all the time. Efficiency, reducing waste. How does that actually work in a hospital?
Right. It might sound a bit odd at first, but the core idea of lean is basically to streamline processes and eliminate anything that doesn't add value for the patient. Waste, essentially. So at Keio University Hospital, this meant things like standardizing how common tasks were done, implementing continuous improvement through regular Kaizen events, little meetings where staff at all levels could suggest and test small improvements, and really focusing on managing patient flow to cut down on waiting times and bottlenecks.
So making the patient's journey through the hospital smoother, more efficient. Did it actually work?
It really did. They reported a 20% increase in patient throughput, the number of patients they could treat effectively, and importantly, patient satisfaction scores went up too.
Interesting.
It really demonstrates that those principles from industry, efficiency, process improvement, when you adapt them thoughtfully, they can be very effective in healthcare.
Okay, adapting is key there. Now, what about overcoming distance? Geographical barriers, the use of telemedicine in rural India, Madhya Pradesh, and Uttar Pradesh, that sounds really innovative.
Oh, it's a fantastic example of using technology to bridge those access gaps. In many rural parts of India, just getting to see a specialist can be incredibly difficult, time-consuming, expensive.
I can imagine.
So this telemedicine project set up connections, essentially video links and remote monitoring tools between local rural clinics and specialists based in urban centers. This meant patients in these remote areas could get consultations, diagnoses, even have their chronic conditions managed, all without having to undertake long journeys. And it also provided great support and learning opportunities for the local healthcare workers, too.
That must have made a massive difference to people's lives in those communities.
Huge. It dramatically improved access to quality healthcare, which led to better health outcomes. And of course, it cut down on the costs and time associated with travel. Technology really acting as a game changer here, making care more equitable.
Yeah, powerful use of tech. Okay, our final sort of deep dive case study takes us to the USA and the rise of patient-centered care, specifically through this model called the patient-centered medical home. What's the main idea behind PCMH?
Right, the patient-centered medical home, or PCMH. It's essentially a model for primary care that, as the name suggests, puts the patient right at the center. It really emphasizes a team-based approach.
Team-based?
Yeah, usually involving a primary care doctor, nurses, maybe pharmacists, other health professionals, all working together to coordinate every aspect of a patient's care. There's huge focus on communication, on making sure patients are actively involved in decisions about their own health.
Right, empowering the patient.
Exactly, and providing comprehensive care, so preventative services, managing chronic diseases, coordinating referrals to specialists when needed. It's really a shift away from just treating illnesses as they pop up towards a more holistic, ongoing relationship between the patient and their care team.
And has it shown results? Is it working?
Yes, the studies generally show positive results. Things like improved patient satisfaction, better management of chronic conditions like diabetes or heart disease, and even reductions in hospital readmissions.
Fewer people bouncing back into the hospital.
Exactly, which is good for patients and good for the system. It really highlights the value of a healthcare approach that's genuinely focused on the individual's needs and preferences.
It's really inspiring, actually, seeing all these different strategies making a tangible difference in so many parts of the world. And we also came across some other interesting global initiatives, didn't we? Sort of smaller examples, but still significant.
We did, yeah. Things like the Global Green and Healthy Hospitals program that's looking beyond just patient care to the environmental footprint of healthcare itself, which is increasingly important.
Good point.
And then you had the Galician Health Service in Spain using electric ambulances, showing that sustainability moves can actually save money too.
Win-win.
Exactly. Then there was the Global Health Advocacy Incubator working in India, focusing on a specific challenge like improving access to hypertension care. They do it through partnerships and strengthening the existing health system. And that GHSP case study about the COVID-19 vaccine rollout in Tanzania.
Oh, yeah, I remember that.
It showed how really tailored strategies and getting local healthcare workers actively involved could significantly boost vaccination rates.
Yeah.
Real on-the-ground impact.
And even closer to home, maybe for some listeners, we saw examples from Southern New Hampshire University. They were focused on very practical improvements, weren't they?
Yes, things like reducing medication errors, always critical, preventing infections, improving how care is coordinated between different providers, and optimizing how sepsis is treated. Plus, there was a long-term study from the NIH in radiology.
Like the 6-year one.
Yeah, showing that consistent efforts on process improvement can have really lasting positive effects. It's not just a one-off fix.
So it builds over time.
Exactly. And all these examples, alongside those bigger trends, we're seeing like the definite shift towards prioritizing the patient's experience, using data much more effectively to drive decisions, applying methodologies like total quality management. It all really points towards this global movement, this commitment to achieving excellence in healthcare.
It definitely feels like a strong current running worldwide. Now, we also learned about a consultancy, Supremedic. How do they fit into this quality improvement landscape?
Right, Supremedic. They seem to operate as a kind of support system, mainly for hospital owners. They help right from the very beginning, the planning and design stages, all the way through to actually achieving accreditation, like NABH in India.
Okay, so practical support.
Very practical. They even offer equity partnerships, which is quite an interesting model. Their services cover a really wide range, helping with recruitment, setting up specialized facilities like modular OTs, managing medical gas systems, procuring equipment and furniture, and, as I said, guiding hospitals through that NABH accreditation process.
So they handle a lot of the nuts and bolts.
Pretty much. And having experts like Dr. Surtaram Vishnoy on their team, someone with deep experience in hospital strategy and quality, it shows the kind of expertise they bring.
Okay.
They essentially provide the practical know-how to actually implement many of these quality improvement ideas we've been discussing.
Okay, so they're helping turn the theory into reality on the ground. That makes sense. Finally then, looking back across all those global hospital QI case studies, were there common themes? Keys to success that kept popping up again and again?
Yes, definitely. Several really important lessons emerged pretty consistently. First, and this is huge, strong leadership engagement is absolutely essential. You need commitment from the top.
Buy-in from leadership.
Absolutely. Without that support, these initiatives often just fizzle out. Second, making performance data transparent and giving regular feedback to the teams involved. That's a really powerful motivator for change. People need to see how they're doing.
Data transparency, okay.
Third, it's crucial to adapt the QI tools and frameworks. You can't just copy and paste. What works perfectly in, say, Japan might need tweaking to be effective in Uganda or the UK. Context matters.
So tailoring the approach.
Precisely. And finally, investing in capacity building training, development for staff that's vital for making sure these improvements actually stick around for the long term. Sustainability.
Leadership, data, adaptation, and capacity building.
Got it. So, to kind of wrap up our deep dive into global healthcare quality improvement, what are the main takeaways for you? What should our listener really hold on to?
Well, I think the biggest thing is seeing this clear, widespread commitment to getting better right across the globe. And while the specific strategies definitely vary, checklists here, training there, technology somewhere else, process optimization, the underlying principles seem quite consistent.
HR.
Things like really strong focus on having well-defined processes, empowering the healthcare workforce through education and support, fostering genuine collaboration between teams and departments, and always keeping the patient, their needs, their experience right at the center of everything.
The patient-centered approach.
Exactly. And as we just mentioned, that critical element of adapting these approaches to the local context, that seems absolutely key to achieving improvements that are both meaningful and lasting. That's actually a really encouraging picture overall. It suggests that regardless of the specific resources or circumstances, there's always a pathway towards providing better, safer healthcare.
I think so.
So, final thought for you, the listener. As you consider all these diverse global strategies and the principles underpinning them, maybe ask yourself, which of these approaches, perhaps the focus on standardization like in the UK, or the community engagement we saw in Africa, maybe the use of technology like in India, or that strong commitment to patient-centered care from the US model, which of those could potentially have the most significant impact in your own context, your own field or area of interest within healthcare?
Good question to ponder.
It is, and we definitely encourage you to explore some of the resources we mentioned today.
Yeah.
Check out the websites for JCI, NABH, ISQA, maybe dig into some of those case studies further to continue your own deep dive into this really vital area.